Assalamualaikum and good day everyone. My name is Nur Alamasara binti Zakaria and my mention number is 1251622. So today I will be presenting the findings from my interview with a professional counsellor, which is Miss Nur Atika binti Rosli. The purpose of this interview was to gain a better understanding of the counselling profession, including the educational pathway, career journey, job responsibilities, workplace environment, challenge faced by counsellor and the counselling approach commonly used in practice. Through this interview, I was able to learn not only about the profession itself, but also about the personal experience and insight of someone who worked directly with clients. I hope this presentation provides a clearer picture of what it means to be a professional counsellor. Before I begin, I would like to introduce the counsellor who I interviewed. Her name is Miss Nurul Atika binti Rusli and she is registered counsellor with ABA1013 and KB11102. Currently, she works as a full-time counsellor and freelance counsellor at Minda Kami in Petaling Jaya. She also worked as a social worker counsellor for children under the Department of Social Welfare or JKM in 2025. Overall, she has almost 3 years of experience in the counselling profession. So, Miss Nurul Atika binti Rosli completed her secondary education at SMA Sabak Bernam. After that, she continued her study in Tamhidi Accounting and Muamalat at University Science Islam Malaysia before pursuing a bachelor's degree in corporate administration at University Science Islam Malaysia. Although her bachelor degree was not directly related to counselling, she later discovered her interest in helping people and decided to pursue a Master of Professional Counselling at University Malaya or UM. Her educational journey shows that career paths are not always linear. With passion and further education, individuals can successfully. Next, I asked Ms. Nur Atika about her main responsibility as a counsellor. She explained that her primary role is to conduct counselling sessions for clients from various backgrounds. Every client has different concerns and experience, so each counselling session requires a different approach. Clients may attend counselling sessions physically at the counselling center or through online platforms such as Thread. In certain situations, home visit may also be considered if the client's condition requires additional support. However, these visits are carefully evaluated to ensure the client's need and the counselor's safety. Besides conducting counselling sessions, she also prepares for sessions, document case notes, and plan suitable intervention based on it. When discussing her workload, Ms. Nurul Atika shared an interesting comparison between her experience at Minda Kami and JKM. At Minda Kami, where she currently works as a freelance counsellor, she described the workload as manageable. One reason she enjoys working there is because counsellors have the flexibility to choose the client they wish to work with. This allows them to manage their schedule effectively and work within their areas of expertise. As a result, she feels less stressed and finds her work more enjoyable. On the other hand, her experience at JKM was much more demanding. Counselors were assigned cases without having the option to choose, resulting in a heavier workload and greater stress. This comparison highlights how workplace policies can significantly affect counselors' well-being and job satisfaction. Other than that, I asked about career opportunities in counselling. According to Ms. Nur Atika, the counselling profession is becoming more recognized and there are increasing opportunities in both government and private sectors. However, she also mentioned that the profession remains highly competitive because there are still limited positions available. She also described the working environment as positive, supportive, and enjoyable. Her colleagues are friendly and willing to help one another whenever needed. The counselling center also provides excellent facilities such as comfortable counselling rooms, a playground for children, and a relaxation area for both staff and client. This facility helps create a safe, welcoming, and comfortable environment, which is very important in counselling practice. One of the biggest challenges is increasing public awareness about mental health. Many people still hesitate to seek counselling because of stigma or misconceptions about mental health service. Another challenge is ensuring that clients continue attending counselling sessions. Since counselling often requires multiple sessions, some clients stop attending after the first session, making it difficult for counselors to help them achieve meaningful progress. Working as a counsellor has also contributed greatly to Ms. Nur Atika's personal growth. She explained that counselling has helped her understand herself better and become more aware of the people around her. Instead of reacting emotionally to difficult situations, she now focuses on understanding why people behave in certain ways. This has made her more patient, empathetic, and emotionally mature. Professionally, counselling has trained her leadership skills and improved her abilities to guide, communicate with, and support others effectively. She believes these personal qualities are essential for becoming an effective counsellor. I also asked about Ms. Nur Atika about the type of client she commonly works with. She explained that many of her clients seek counselling for self-identity exploration, especially adolescents and young adults who are trying to understand themselves better. She also frequently handles cases involving anxiety, social anxiety, communication difficulty, and relationship and couple counselling. Each client has unique needs, so counselling approach and intervention must always be tailored to the individual rather than applying Another important topic discussed during the interview was organizational support. Ms. Nura Atika explained that counselor at Minda Kami are encouraged to work collaboratively instead of handling every case independently. For example, Ms. Nura Atika is not experienced in managing trauma cases, so she will be referred to another counselor who has the necessary expertise. Counselor also discuss cases with colleagues in a professional manner while maintaining client confidently. This support system help counselor continue learning from one another while ensuring that client receive the most appropriate care. I asked about the counseling theories and techniques she commonly used. She explained that every counselor should have a strong foundation in person-centered counseling or PCC. PCC focus on allowing clients to express themselves freely while respecting their autonomy and ability to make their own decision. This approach is especially useful for being a counselor because it emphasizes empathy, active listening, and building a strong therapeutic relationship. For intervention, she commonly applies cognitive behavior therapy or CBT, which help clients identify and change unhelpful thought patterns. She also used rational emotive behavior therapy or RABT, which help clients challenge irrational beliefs and replace them with healthier ways of thinking. About counseling technique, Ms. Nurul Atika, for deeper exploration of client emotion and past experience, she sometimes incorporates psychodynamic technique and use exploratory questionings. In terms of practical techniques, she frequently uses art therapy with adolescents and play therapy with children, as this approach helps younger clients express emotion that may be difficult to communicate verbally. Overall, she emphasized that no single counseling theory is suitable for every client. Professional counselors must adapt their approach according to each client's unique needs and circumstances.